Good morning students. Today's class we will see about the care of a newborn on incubator. Incubator is an apparatus for maintaining an infant, especially a premature infant, in an environment of controlled temperature, humidity and oxygen concentration. The incubator is a closed system with heating element underneath and transparent hood or canopy around the baby tray. Air oxygen mixture is sucked in through a microfilter and streamed over a heating element humidifier using in a quiet fan. The warm humidifier air is then circulated through the hood to attain uniform temperature within. The incubator is a form of a trolley, normally with the mattress on the top covered by a plastic cover. This chamber provides a clean environment and helps to protect the baby from noise, infection and excessive handling. A low rate of air circulation, ideally not more than 20 to 30 liters per minute, minimizes the convective heat losses due to fast current around the baby. Noise level within the incubator is kept below 60 decibel to avoid deleterious effect on hearing. A temperature sensor is tapped to the baby's skin and the incubator heater adjusts to maintain the baby at a constant temperature, or a temperature is controlled by thermostat in a heated stream. Incubators reduce convective and radiation heat losses by reducing exposure to air currents and by providing warm environment. Evaporative loss are minimized by maintaining high humidity in the incubator. Radiator losses are curtailed by hood or canopy on the baby or by using double-walled incubators. Access holes called iris pods elbow operated to open and close. The underdeck area should be corrosive resistant, molded and easy to clean. Other components include air inlet, filter, fan or blower system, humidity tray, baby tray with a mattress and inlets of oxygen, IV tubing and temperature probes. A good quality equipment should have smooth surfaces and be free of corners and service. Additional to optional features which may be attached to an incubator include an intravenous stand, weighing scale, timer, tilt facility, battery backup, oxygen analyzer, resuscitator, vital signs monitor, phototherapy unit, oxygen flow meter, suction, ventilator, etc. Purpose of ventilator in incubator. When they are not maintaining their own temperature with the clothing and wrapping, when they are acutely unwell and close observation is required, when they are risk of abnormal heat loss, they have non-infection or potential to develop sepsis when the baby requires transportation. Main purpose of carrying a neonate incubator is: first one, to maintain the thermoneutral ambient temperature, provision of desired humidity and oxygenation, observation of very sick neonate, isolation of newborn babies from infection, unfavorable external environment. Main functions of incubators are temperature control, oxygen concentration, humidity control and breathing gas filtration. Indications of incubator. Generally, all premature babies with a low birth weight may be stable. Hypothermic child. Sick children need incubator and its care. Frequently, incubator is used to transport babies from one place to another, like referral to another hospital, within the hospital, or for various investigations like CT scan, MRI. Neonates who need close observation are also kept in incubators. Parts of incubators are canopy with the portholes, the heat source with fan, underneath the baby, air probe and control panel. Types of incubator. The first type is portable and non-portable. Portable incubators can be used to shift the baby to another area. Second one is open box type. This is also known as Armstrong. Here neonate is kept in the plexiglass bassinet. A radiant warmer can be attached if needed. The main disadvantage of this type of incubator is it cannot maintain thermoneutral environment. If the lids are opened frequently, despite it can not filter the air and neonates directly in contact with the external environment. It has only advantage: the neonates in this incubator can be observed well and can be handled easily. Third type is closed type. Closed type incubator has special function to concentrate fresh air after filtration. It prevents water loss from radiation. As neonate remain inside the box, the risk of infection is minimal. The fourth one is double wall. The incubator has two walls as the air is not a good conductor of heat. The incubator prevents heat and fluid loss. Nursing care of a child in incubator. Step 1. Prepare the incubator pre-warmed to temperature appropriate to infant's age, size and condition. Use air mode and must have always switched on with the monitor running if in use for a baby. Check and record incubator temperature hourly. Position away from draughts or direct sunlight. Ensure alarms self-test has been completed. If the unit fails to self-test, the alarm sounds with the one or more messages are displayed in the alarm window. Step 2. Care of a baby. Maintain axilla temperature between 36.5 to 37.2. Access baby by using portholes. Limit opening of large door as this interferes with air temperature. Ensure baby's nurse neck apart from nappy. Position baby utilizing rolled towel cloth nappies to provide boundaries that support nesting and flexion of limbs but keep face clear. Explain parents or caregivers the purpose of an incubator. Ensure the familiar with how to access the baby as it is optimal for the parents to continue to touch and provide comfort. Maintain a quiet environment. There is no tapping on the canopy. Not required is placed on the top of canopy. Careful opening and closing of the door. Step 3. Adjusting incubator temperature. Default incubator temperature in NICU is 35 degrees. Adjust the incubator temperature by not more than 0.5 degree at a time. Recheck temperature within half an hour by making any adjustment. Step 4. Axilla temperature is taken on admission on the incubator and rechecked in the first hour. Temperature is documented 4 to 6 hourly as per the condition. Use of humidification is utilized for the incubator care of the preterm babies only, not required for babies more than 32 weeks of gestation. When the incubator is occupied, it should be cleaned daily with mild detergent. Humidified chamber must be emptied and cleaned daily, filled with fresh distilled water. After 7 days, neonates should be shifted to another incubator and used incubator should be cleaned with antiseptic solution. 1 to 2 ml of glacial acetic acid or vinegar can add to the water in the humidifier to prevent bacterial growth. Special consideration include important that the incubator should not be interfere with observation of neonate and quality of care. Sensory stimuli like light and pain should be kept to the minimum. When neonate develop fever, the incubator modes have to be changed with normal modes. When neonate is nursed in a front position, the skin sensor is placed over the flank and should be not touch bed. The bathing is postponed in neonate in incubator. The daily linen should be kept within the nursery to keep the warm. No alarm should be ignored. Thank you. Thank you for listening.